Managing kidney disease involves understanding how lifestyle factors like alcohol consumption can impact overall health. For individuals with CKD, alcohol presents unique challenges as it can strain already compromised kidneys, interact negatively with medications, and contribute to long-term health problems such as hypertension and liver damage. Alcohol also tends to be high in sugar and calories, which can further complicate the management of a specialized renal diet. These risks make it crucial for CKD patients to approach alcohol with caution and mindfulness. However, enjoying alcohol in moderation is possible with careful planning and smart choices. Opting for lower-calorie drinks, limiting intake to occasional indulgences, and staying aware of potential interactions with prescribed medications are key strategies. By balancing enjoyment with precaution, individuals with CKD can participate in social activities while minimizing risks. The focus should always remain on maintaining health and adhering to a renal diet, ensuring that alcohol consumption does not hinder long-term well-being. You might be wondering about who I am and why I'm qualified to talk about this. If you're someone living with chronic kidney disease, I've got great news for you. Hello, I'm Mathea Ford, a registered dietitian nutritionist specializing in chronic kidney disease and owner of RenalDietHQ.com. I specialize in helping people just like you improve their health by making simple yet delicious changes to your meals. Together, we can transform your eating habits, boost your overall well-being, and ensure that you're enjoying every bite along the way. Say goodbye to bland and boring meals and say hello to a healthier, more vibrant life. Let's get started on this incredible journey to better health together. Visit RenalDietHQ.com today and take the first step towards a healthier lifestyle. Alcohol has been a cornerstone of social culture for centuries, but its effects on the body, especially on the kidneys and liver, demand careful consideration, particularly for individuals with existing health conditions. Research reveals that even moderate alcohol intake, such as less than 2 drinks per day, can negatively impact kidney health by impacting and elevating blood pressure, increasing inflammation, and causing dehydration. Over time, these effects can heighten the risk of chronic kidney disease. Heavy alcohol consumption amplifies these risks and may lead to kidney damage while simultaneously straining other organs such as the liver. The liver, essential for metabolizing alcohol, is particularly vulnerable to harm from excessive drinking. Heavy alcohol triggers oxidative stress, leading to cell damage and fatty infiltration, which can result in conditions like cirrhosis, scarring of the liver that impairs the function and may lead to failure. For individuals with kidney or liver conditions, the safest approach is often to avoid alcohol altogether. However, if moderate consumption is chosen, it is crucial to consult with a healthcare provider to understand safe limits and minimize risks. Reducing or eliminating alcohol consumption can bring numerous health benefits, including improved heart health, better sleep quality, and a stronger immune system. It can also lead to weight loss and a reduced risk of developing certain cancers, cardiovascular diseases, and liver problems. These positive lifestyle changes often contribute to enhanced mental health and overall well-being. For those looking to make healthier choices regarding alcohol, options include simply cutting back on the amount consumed each week or month, shifting focus to other enjoyable activities such as exercise, gardening, reading, or socializing can help create healthier habits. Setting clear boundaries about when it is appropriate to drink and choosing to engage in alcohol-free social interactions are crucial steps in fostering a balanced relationship with alcohol. By making intentional and mindful decisions, individuals can take control of their health, build more meaningful connections with others, and achieve lasting physical and emotional well-being. Alcohol is a toxin, and its misuse can lead to devastating effects on the liver, including alcoholic liver disease, a major cause of mortality worldwide. ALD affects 4 to 8% of the general population, but is significantly more common among heavy drinkers. The most severe form of ALD, cirrhosis, occurs when long-term alcohol abuse replaces healthy liver cells with scar tissue. This condition can cause life-threatening complications such as jaundice, ascites or fluid buildup in the abdomen, bleeding esophageal varices, encephalopathy, and even death. Another form of alcoholic hepatitis results in liver inflammation due to excessive drinking over time, presenting symptoms like abdominal pain, nausea, jaundice, and fatigue. If untreated, it can progress to fibrosis and eventually cirrhosis, further impaired liver function, and leading to vitamin deficiencies and chronic inflammation, which heighten the risk of liver cancer. Given the severe consequences of excessive alcohol consumption, it is vital to drink responsibly or abstain altogether. Maintaining moderate or following recommended guidelines set by health organizations can help protect against these life-threatening diseases. For those with pre-existing health conditions, especially liver or kidney issues, consulting a healthcare provider about safe alcohol consumption is essential. By making informed choices, individuals can safeguard their health and reduce the risks associated with alcohol misuse. Alcohol significantly affects the kidneys, particularly when consumed excessively or by individuals with existing kidney disease. While moderate alcohol intake in healthy individuals rarely impacts renal function negatively, excessive drinking can cause dehydration and strain on the kidneys. Alcohol inhibits the production of vasopressin, a hormone responsible for fluid balance, leading to increased urine output and excessive water loss. This dehydration weakens the kidney's ability to filter waste effectively and perform other vital functions like blood pressure regulation, often resulting in elevated creatinine levels, a key indicator of kidney injury. Additionally, chronic heavy drinking raises the risk of conditions like hypertension, diabetes, and obesity, all of which are linked to an increased prevalence of kidney disease. For those with kidney disease or concerns about alcohol's impact on renal health, it's crucial to approach drinking cautiously. Excessive alcohol intake can exacerbate kidney damage and other medical conditions, underscoring the importance of discussing alcohol consumption with your healthcare provider. By seeking personalized advice, individuals can make informed decisions that prioritize their health and reduce their risks associated with drinking. Alcohol can impact not only your blood sugar levels, but also essential like potassium and phosphorus, which are crucial for individuals on a renal diet. A single serving of wine, 5 ounces, contains approximately 26.5 milligrams of phosphorus and 104 milligrams of potassium, as reported by the USDA. For context, CKD patients are typically advised to limit their intake to 800 to 1,000 milligrams of phosphorus and 2,700 to 3,000 milligrams of potassium daily. However, it's important to remember that mineral content can vary between types of wine, with sparkling varieties often containing slightly higher levels. When considering alcohol consumption, always review other nutritional factors like calories and carbohydrates, and consult your physician to ensure compatibility with your specific renal diet plan. Staying informed about low potassium diet strategies can empower you to make better decisions that align with your health goals. Knowledge and caution are key to managing your mineral intake while navigating the complexities of a kidney-friendly lifestyle. When it comes to a renal diet, alcohol is generally discouraged, but if beer is part of your occasional indulgence, understanding its nutritional content is crucial. A standard 12 fluid ounce serving of beer contains about 92 milligrams of potassium and 38.9 milligrams of phosphorus. While these levels are relatively low, dialysis patients and those with kidney disease should still monitor their daily intake of these minerals. It's worth noting that darker beers typically have higher levels of magnesium, iron, zinc, and copper compared to lighter varieties, and specialty craft beers may contain more potassium and phosphorus due to the use of grains and hops. Moderate beer consumption can be incorporated into a balanced renal diet with the guidance of your dietitian. Checking nutrition labels and being mindful of the type and quantity consumed are essential steps to ensure your choices align with your dietary needs. Staying informed about the nutritional content of different beers empowers you to make decisions that support your kidney health while allowing for occasional enjoyment. Understanding standard serving sizes can help you stay within safe limits while adhering to your dietary plan. A single serving of beer, wine, or hard liquor contains 0.6 ounces or 14 grams of alcohol. For example, a 12-ounce, 355 milliliter beer with 5% alcohol by volume equates to 1 serving, while a 750 milliliter bottle of wine, typically containing 10 to 14% alcohol, holds approximately 5 servings. Mixed drinks generally use 1.5 ounces or 44 milliliters of 80 proof spirits like vodka or whiskey, which also constitutes a single serving. To minimize health risks, the dietary guidelines for Americans suggest no more than 2 servings per day for men and 1 for women, given the higher risks associated with conditions such as diabetes and cardiovascular disease. Adhering to these limits is especially important for individuals with CKD. Always consult your dietitian before making any adjustments to your diet or alcohol intake to ensure it aligns with your specific health needs and goals. Alcohol can significantly affect people with chronic kidney disease, particularly because many alcoholic beverages like beer and wine contain high levels of phosphorus. Phosphorus is a mineral found in various foods, and when consumed in excess, it can interfere with the body's ability to absorb calcium, leading to weakened bones. For individuals with CKD, managing phosphorus intake is crucial to avoid complications such as bone fractures. While moderate consumption of alcohol might be acceptable for some, it's important to be aware of the ingredients in alcoholic beverages, as they contain not only ethanol, but also sugar or added flavors that may further increase phosphorus levels. Additionally, certain sweeteners like fructose and sucrose, often found in flavored alcoholic drinks, can raise blood glucose levels rapidly, complicating the condition for those with both CKD and diabetes. Therefore, it's essential to consult with a healthcare provider or nutritionist before consuming alcohol to determine how much is safe based on individual health needs. With proper monitoring and adherence to CKD-specific dietary guidelines, it is possible for individuals to enjoy alcohol responsibly without compromising their kidney health. Let's talk about medications. The relationship between alcohol and medications for people with kidney disease can be complex. While moderate alcohol consumption may offer some health benefits, excessive drinking can interfere with the effectiveness of medications prescribed for kidney disease. For example, alcohol can increase blood pressure when combined with ACE inhibitors, blunt pain relief when taken with pain medications, and lead to dehydration and electrolyte imbalances when mixed with diuretics. These interactions can make it harder to manage kidney disease and may even exacerbate existing conditions, leading to serious health complications. It's crucial for individuals managing a renal diet and taking medications to understand how alcohol can impact their treatment plan. Before consuming alcohol, kidney patients should consult with their healthcare providers to ensure that it won't interfere with their medication regimen. Mixing alcohol with certain drugs could worsen medical conditions, cause severe side effects, or in extreme cases, lead to death. As such, kidney disease patients must carefully consider their diet and beverage choices. It's essential for moderate drinkers to work closely with their doctor to determine safe alcohol consumption levels based on their health status, medications, and individual factors such as weight and age. Ultimately, only a healthcare professional can confirm whether drinking alcohol is safe while on prescription medications for kidney disease. Drinking alcohol while following a renal diet can be risky for people with kidney disease, as it may exacerbate the condition and lead to long-term health complications. The best approach is to reduce or eliminate alcohol intake, as this will help protect kidney function and prevent the buildup of harmful substances in the body. While some alcoholic beverages may be lower in calories and contain beneficial nutrients like protein, they still carry potential risks for those with kidney disease, making moderation crucial. Though reduced may raise concerns about increased stress or social isolation, the benefits for individuals with chronic kidney disease outweigh those potential challenges. Decreasing alcohol intake helps avoid the toxic effects alcohol can have on a compromised kidney system and may result in improved overall health. If you have kidney disease and are considering cutting back on alcohol, it's worth discussing the decision with your healthcare provider to ensure that any changes you make align with your health goals. With careful consideration, reducing alcohol can help safeguard your kidney health while still allowing occasional enjoyment.